Hello everyone, as always it is good to see you. It's not an outbreak yet, but fears around black fungus are growing. Doctors in Maharashtra, Karnataka, Gujarat are reporting a rare fungal infection that has found a new life in this second wave. The medical community calls it mucormycosis. It is caused by exposure to the mucor, mold, which is commonly found in soil, in plants, manure and decaying fruits and vegetables. It occurs 12 to 15 days after you recover from Covid-19 and usually attacks people with diabetes. It's dangerous because it kills more than 50% people it infects. We are talking about it today not to cause panic, but to ensure that all of you watching right now know when to spot it and how to get it treated. Many of you who have tested negative are also reporting extreme fatigue, brain fog, muscle pain, blurred vision, many other symptoms. Long Covid, by the looks of it, is here to stay. We are talking about that as well on Debrief today. First, a report on black fungus, the newest killer on the Covid block. It was timely treatment in Mumbai that saved 59-year-old Ratna Mane. Mane suffered from nosebleed and pain in his jaw just a few days after recovering from Covid-19. He was diagnosed with mucormycosis.
कोरोना ट्रीटमेंट के बाद अगर आपके चेहरे से किसी भी हिस्से में दर्द हो रहा है या साइनस में दर्द हो रहा है या नाक से खून आ रहा है तो तुरंत अपने डॉक्टर से मिलें.
Gujarat resident Bhavna Jani wasn't so lucky. Bhavna had a bleeding nose days after she recovered from Covid-19. Despite treatment, she succumbed to the infection on 30th April. What is mucormycosis and what causes it? It's a rare but serious fungal infection, often a complication post-Covid recovery. It is caused by a group of molds known as mucomycetes. The most vulnerable patients are those on medication for health problems that lower immunity, like diabetes. It usually presents as pain and redness around the eyes or nose. This could be accompanied by fever, headache, cough, shortness of breath, bloody vomits, and altered mental status.
From the sinus, the infection which is mucormycosis or black fungus, they get infected in the nose and paranasal air sinuses. From the nose, there is a very easy tract which can go into the orbit, that is the back side of the eye. And it goes into the orbit and causes orbital apex syndrome. So the patient loses complete vision. There is total blindness in the eye. And from the orbital apex, the infection then goes in the brain. And if unchecked, can cause, and it generally does cause the death of the patient within a month or two.
Doctors believe that steroids given to patients suffering from coronavirus sometimes weakens the immune system and increases the amount of glucose in the body, which further increases the chances of getting black fungus.
As this disease affects the people who are having a lesser immunity or immunity has gone down because of certain. So these are the high risk patients. So high risk cases are diabetic patients, those who are on dialysis, those who are having chronic kidney disease or on the steroid treatment. They should observe for early symptoms, and as soon as you have any of the early symptoms, you can get an expert opinion from an ENT doctor, and early diagnosis can cure this disease.
While cases are on the rise, there has been no major outbreak yet.
सुनने में आया है कि कुछ एरियाज़ में कुछ इन्फॉर्मेशन मिलती है कि जो कोविड से ठीक हो गए, कोविड चल रहा था उनको म्यूकोरमाइकोसिस हुआ, लेकिन ये भी याद रहे कि ऐसी बहुत बड़ी कोई आउटब्रेक हो रही है ऐसा भी नहीं नज़र में है, वॉच कर रहे हैं और अपने तरीके से इसका सर्वेलेंस हम कर रहे हैं.
But that is no consolation for patients recovering from Covid-19. With Natasha Menden and Herman Gomes, I'm Shreya Dhoundial. Now, black fungus is just one of the things that Covid-19 is leaving us with. It is rare to an extent that in the last 3 to 4 weeks, Maharashtra and Gujarat together have reported only 1,000 or so cases. But symptoms of long Covid are much more common. It impacts every organ of your body and recovery can take months. NC Satpathy getting us more on that. from symptoms like lasting fatigue, persistent pain, and breathlessness for months, many survivors struggle to grapple with the long-term effects of COVID-19, which is often known as long COVID. Doctors say a patient's immune system does not return to normal long after the virus has been neutralized. A new study by the medical journal Nature says COVID-19 could increase the risk of death and chronic medical conditions even in people who did not need hospitalization. Those patients had a 60% higher death risk in 6 months than people who had not been infected. Those with comorbidities are at even greater risk. COVID-19 survivors experience a raft of long-term medical problems, not just respiratory effects. Symptoms that could affect any organ system or part of the body, from neurological to cardiovascular to gastrointestinal to mental health problems, anxiety, and even sleep disorders.
Covid has an after effect on many organs of the body. It includes brain, it includes heart, it includes pancreas, it includes kidney, it includes joint. So because COVID is a systemic infection and there is an inflammation and microclots going into many organs of the body.
In some COVID-19 survivors with diabetes, kidney and heart conditions, it could turn into chronic health problems that would need treatment for the rest of their lives. Adults who are 50 years and older, women, and those with underlying health conditions are at the highest risk. The most common symptoms of long COVID are crippling fatigue, extreme exhaustion, breathlessness, cough, joint pain, muscle aches, hearing, eyesight problems, and headaches. Apart from long COVID, doctors have observed that prolonged complications for some patients may be related to vital functioning. In our respiratory system, COVID-19 could inflame the lungs. It could also cause damage to the hepatic tissue of our body. The vital organs' functions don't regain normalcy. In our cardiac system, in many cases, COVID-19 causes clotting of blood cells and increases the possibility of a heart attack during the treatment or even months after the recovery from the contagion. The other common symptoms are unusual heart rate, palpitations, recurring chest pain as well. COVID-19 can also reduce kidney functions amongst people who suffer from high blood pressure or diabetes. Digestive problems such as upset stomach, cramps, nausea, loss of appetite are common as well. And here is something most people who have gone through COVID experience as well. Many suffer long-term brain fog. Some experience brain strokes and seizures. It has also been found to be spreading diseases like Alzheimer's and Parkinson's.
So people who are caregivers to COVID patients, they should look for confusional states, loss of memory, irritability, persistent sadness even after the disease is over, a tendency to sway while walking, if the patient is lethargic most of the time.
The deadly virus severely compromises people's health and leaves debilitating effects on the rest of their lives. It has made most of us long haulers. What can we do to prevent it? As the old saying goes, prevention is better than cure. With NC Satpathy, I'm Shreya Dhoundial. Dr. Ravindra Mehta is a pulmonologist. He is the Chief of Critical Care at the Apollo Hospital in Bangalore. He's joining us on the show. Dr. Mehta, thank you very much for your time. I know all of you are incredibly busy, given the large number of cases that are being reported from Bangalore. Let me start with black fungus that has created such a splash in this last 1 month. We didn't hear of it in the first wave. Why are we hearing it or seeing it now in the second wave?
So thank you, Shreya, for having me. And this mucormycosis or black fungus was there last year also. It's just that the enormity of it is just is increased right now. It's incrementally more. And it's because we've got such a huge number of cases in a short span of time. So we've gone spiraling high in the speed at which COVID hit the country. And because the standard therapies include all of what you were talking about, steroids, sugar issues, and immunocompromise, and so on. And that's why we're seeing the after effect of that. So it's just a very big reminder that you're not done till you're done when it comes to COVID-19. This mucormycosis is lethal. At least long COVID, most of them are fixable and improvable conditions if you're able to hold people's hand. So this is the situation that now the full extent of this black fungus will be borne out only when it's done, because it doesn't happen right away. It happens to people who survive and over time and so on. So we'll have to see how this bears out in different parts of the country. And it's an alert to the way COVID is really startling us with so many things even after the patient gets better and gets out of the acute insult.
Doctor, you've spoken about this, and there are many other doctors who are saying that possibly the use of steroids is what is triggering the black fungus. Is that the only reason? Because I believe it originates in the soil. I mean, what does steroids have to do with the fungus that actually originates in the soil?
Yes, it's a very good question. So this is what's called a commensal. Commensal is a technical term for an organism which lives with us. So mucormycosis is part of our environment. Usually our immune system is good enough to keep this fungus at bay, and it doesn't really cause problems. In the past, if you take COVID-19 out of the picture, this was usually seen in people who had this sort of cancer chemotherapy or steroid therapy with sugar issues. And uncontrolled sugar along with all these things was the risk factor. Come COVID-19, mid-July last year, steroids became the standard of care. It was steroids, steroids, and steroids. Now, when you add steroids given at least for 10 days in people with moderate to severe COVID, and then you understand sugars going up, and this unique effect which you guys also have mentioned about COVID itself, making the immune system come down, you get a unique, unusual combination for this fungus to become stronger than it was, overwhelm our weak immune system, and get its manifestations. The sad part is if it goes all the way into the eyes and the brain, it is very, very dangerous and catastrophic. The medications are difficult. Everybody requires surgery. So it's a wake-up call to understand that one medication which does good has to be given, but we have to temper it and at the same time figure out that down the line cascading effects have to be diagnosed and treated so that we get people out of these difficult times.
And more importantly, I think, doctor, patients need to know and patients' families need to know, don't force your doctor to give you a particular medicine, whether it's steroid or remdesivir. The doctor knows what he or she is doing. So let them make the decision. You don't force it upon them, because that is something that is happening all across the country, Dr. Mehta. Very quickly, how do you spot black fungus? What are the red flags and how do you prevent it?
Right. So if I can interject and take 30 seconds on your last statement, it's actually worth its weight in gold, because these steroids are being given too soon, too quick. It's like every medication gets overused. So rather than giving it the right time, either because of providers or of patients, unnecessarily overuse is happening sometimes. And your statement actually has so much importance, because we have given it the right time, it will save a life. Given indiscriminately, we have no face to, deal with the complication. That's one thing. And now coming back to your original question, black fungus or mucormycosis is something which happens in this area. It's a nose, eye, and brain infection by and large. So the first thing is in nose involvement or sinus involvement, people will start getting pain in this area or in the sinus area. So people with no history of sinusitis, nothing has happened to me before. Now I'm getting irritation out here. Gradually they'll be throbbing, they'll be feeling of discomfort. So that is the earliest indication. So now with such clarion calls going around, these are the things to worry about. By the time it reaches the eye or the brain and we're getting loss of vision or this sort of altered coma and all, it's very, very late. So clarion calls, if it happens, if it's a sinus issue, no problem, get an online consultation. At least your doctors can figure out that you got steroids and so on. And if required, a CT scan, which is so common now, and the cost also has been cut in places like Karnataka, it can at least set your clinical path on the stage to diagnosis and recovery.
Dr. Mehta, I also very quickly want to talk to you about long COVID. We have so many friends, so many colleagues, so many family members who have tested negative and yet have not been able to get out of bed. You are saying with COVID, you're not done till you're done. In this case, many people are simply not being done, even after spending 15 days in bed.
Yeah, so the long COVID part of it is something which came up last year. It was frightening when they showed that in the Italian population, 70 to 80% was suffering from some sort of disability for a long time. Fortunately, in India, we've seen around 10 to 15%, and even the US guys who've reported stuff tell us it's 10 to 15%. The concerning part is what you just said. It's just that these multi-system, multi-area manifestations don't allow us to get back on our feet. Usually in illnesses, we expect that illness is done, maybe 4, 5, 7 days of recovery, and I'm back to where I was. Thank God I've beaten COVID. The issue is this tail part of it, this concerning part of it is longer. However, I think since we know it better, we're in a position to tell people who go home, these are the things to watch out. Hydrate yourself well, exercise, be in touch with us. These are things you can hold on to. And the most important, there should be no underlying despair and depression. Knowledge, interaction with providers, and knowing this entity will help us to minimize the hit so that ultimately we get these people back on their feet again.
But how do you tell I'm suffering from long COVID? Because all the symptoms that we have listed out for our viewers today, I mean, it's almost like koi bhi bimari ho, you can pin it back to long COVID.
But चक्कर ये है कि पहले भी तो वायरस थे हमारे पास. We had viruses before also. After a reasonable amount of time, say example, I get moderate to severe COVID, I spend 10 days in the hospital. After I go out, after 7 to 10 days, assuming there's no major respiratory issue, I should be out of it. When it goes beyond that, and I'm not able to get up in the morning, I've got aches and pains, I'm not functional, I can't return to my job, that is when it happens. So an unreasonable amount of symptoms persisting beyond the clinical course, to use a technical term, is long COVID. Now, what I would like to point out is a lot of these symptoms can be dealt with very simply. Understanding them, facing them, and hydration, exercise, moving, walking is a very, very good solution.
Okay.
Symptomatic therapy and looking at underlying, worry, depression, anxiety. Everyone is worried, Shreya. Everyone knows somebody who has literally gone down with COVID can help to tackle it. So there is an entity and there is a way to mitigate the entity. We know enough to at least make people understand that, okay, this is going to get better. You're going to pull out of it. That is a major message to give out.
All right, Dr. Mehta, we leave it there for the moment. Thank you very much for joining us and clearing our doubts and confusion. It was important to hear you speak, and important also to remember that if you're hearing of people dying, please remember that our recovery rate is one of the best in the world. People are going to hospital, yes, but they are going back home as well, fit and well. Some may have long COVID. Yes, there is a risk of black fungus as well. Just keep an eye out for symptoms, but know that eventually all will be well. And the moral of the story, I think, is that prevention is better than cure. With that, a very quick break. Up next, a COVID drug that is being called a game changer. We are meeting the scientist behind the 2DG drug developed by the DRDO. Do stay with us. Welcome back. You're watching Debrief. After a year of trials, the DRDO is ready with its anti-COVID drug called 2DG. It has been given emergency use authorization and some hospitals are already using it to cure patients. What does it do and why is it being called a game changer? Take a look at this FAQ we have put together.
What is 2DG?
The indigenous drug 2-deoxyD-glucose has been developed by DRDO and Dr. Reddy's labs.
How does the drug work?
It accumulates in infected cells, stopping the virus from multiplying. This drug also reduces the dependency on oxygen and helps with faster recovery.
Does it work on critical patients?
The medicine has been proven to be effective in moderate to severe cases as well as in patients with age above 65.
How is the medicine consumed?
This powder has to be mixed with water and consumed orally.
How much does the DRDO's drug cost?
Prices are not confirmed yet, but it's likely to cost about 500 to 600 rupees per sachet.
Is the drug available in the market?
Not yet, but mass production is expected to begin soon.
Dr. Reddy's is the industry partner for DRDO in developing this drug. Dr. Anant Narayan Bhatt is a senior scientist at DRDO and part of the team that has developed the 2DG. He's joining us on Debrief today. Dr. Bhatt, first of all, many congratulations to you and your team. Why are you so confident about this drug being a sure shot cure for COVID-19?
Yes, I mean, the mechanism of this drug is like that it it stops the multiplication of virus. That is one thing. And then the other problem which is coming into because of this COVID virus, which goes in SARS-CoV-2 virus, it is causing huge inflammation in the people, I mean in the body of the patients. So this drug has antiviral effects also. So that is why we are very confident that it has two actions for the patients. So that is why we are very confident that this drug is definitely going to work in COVID patients.
What have the trials shown about its efficacy? I understand it's being used in hospitals right now, but what is it? What is its efficacy? How is it effective?
So the basic, the WHO ordinal score, which is was the basic parameter on which we, measured the patient's recovery rate. So the majority of the patients who were recruited, they were on score 5. That means they were when recruited, they had their oxygen level was very low. Oxygen saturation level was low, and they were recruited at around between like 82, 83, 85, like that. And when they were treated with the drug, a majority of the patients by day 3, which we have given the data, by day 3, around 42% people came out of supplemental oxygen requirement. So that is what is the basic crux of our data, that at very early stage, this is bringing a lot of people out of supplemental oxygen requirement, which is currently the need of the country.
It is the need of the hour right now, given that we have run out of oxygen. Any side effects of the drug?
Yeah, side effects, there are not much side effects were seen, what we call significantly not, side effects were not significant. Okay. So they were much below than 5%, which we see. And the side effects were also like some people, they do have perspiration or something like that. So there are not much side effects have been observed.
Okay, so is it safe for all age groups, including the elderly population?
See, currently the trial was done 18 and above. Okay. So, and emergency use approval is also given based on the trial only. So currently, unless we get complete approval, which will be eventually come in a month's time. So after completing all the formalities, after that probably we'll be able to use it in less than 18 years also.
Okay, but what about the elderly population above the age of 65? Is it safe for them?
Exactly, because we have shown that in our data also that the rate of recovery is similar in patients more than 65 years also, which we have observed in the total population. The same rate of recovery was seen in elderly population also, which were more than 65 years. So in trial, we have recruited patients up to 84 years. Some of the patients were 83, 84 years old, and the recovery rate was very good even in them also.
Dr. Bhatt, given the fact that right now we don't have enough drugs to treat COVID-19, will your drug, the DRDO drug, the 2DG drug, be a game changer?
Actually, in our trial, whatever we have done, this was given as an adjunctive to standard of care. Okay. And this standard of care throughout the trial was changing. You know, like when we started the trial in May 2020, the standard of care was like, vitamins, and then vitamin D, and then hydroxychloroquine and several other things. So slowly, when antivirals came, then the standard of care became antivirals also. So this was given on top of it. So that recovery rate is very good as compared to standard of care alone. But it is given as an adjunctive only. It will be given along with the standard of care.
Okay. And will it be available over the counter anytime soon?
Yes, emergency use approval is given for hospitalized patients only. It will be given in the hospitalized patients only. But suppose that if doctor prescribes and he's, confident that if doctor is telling that when he's sending the patient from hospital, probably they can prescribe to them also. It depends completely on the prescription of the doctor.
Thank you so much, Dr. Anant Narayan Bhatt, for joining us, and many congratulations to your team once again. Now, the DRDO is confident that the drug can be mass-produced in India and reach every hospital and healthcare center in this country. With that, it's a wrap from me. Thanks very much for watching.